From the 1800s to post-World War II, Boyle Heights emerged as a working-class immigrant hub welcoming Jewish, Japanese, Mexican, Italian, Russian, Armenian, and African communities. Systemic discrimination affected the neighborhood. Federal redlining in 1940 labeled its racial diversity as a financial risk, and the World War II incarceration of Japanese Americans devastated local families. Today, Boyle Heights remains a predominantly Latino and immigrant community, while continuing to honor and reflect its rich multicultural history.
The neighbors, the people, they're friendly. If you go and everybody's friendly. Everybody works. So I think that's the focus. They celebrate, for the most part, they try to help each other.
While exploring Boyle Heights, our group stumbled upon a family-run and operated charro suit store, which makes traditional Mexican suits for the greater communities around Los Angeles.
Es una tienda de traje charros, aquí los hacemos nosotros, fabricamos, tenemos algo muy poco hecho de México.
Estando aquí en la área, ¿le puedo preguntar cuántos años ya tienen ustedes aquí con esta tienda?
Tiene mi hermano, ¿qué? 20 años.
Oh, 20
20
años. ¿Y ustedes han trabajado aquí por todos los 20
Por
años?
esos 20 años sí, pero mi hermano en el área ha trabajado más de 40 años.
Oh, yo sé que ustedes nomás trabajan aquí, pero cuando ven la área, parecen que hay áreas donde pueden comprar alimentos, como comida accesible.
Sí, están 2 supermercados aquí cerca y tiendas pequeñas de aquí de la comunidad.
Okay. Y de las tiendas, ¿piensa usted que hay acceso a alimentos saludables o es más como comida chatarra o es un variable?
Sí hay acceso, lo único que muchas personas hacemos a veces que nos vamos por lo más fácil, pero
sí.
de que sí hay comida accesible, saludable, sí hay.
Sí, nosotros que somos estudiantes y estamos como en la salud médica, ¿qué es algo que usted quiere ver como mejorar que nosotros podemos hacer en el futuro ya que estemos practicando?
Que tengamos más accesibilidad a las consultas médicas, porque siempre nos dejan que para 3 meses y cuando tenemos una emergencia vamos al hospital y a veces son 4, 5 todo el día esperándonos ahí para que nos digan no, esto no era una emergencia, pero como no tenemos acceso al médico, por decirlo, cuando estamos enfermos, sino que tenemos que llamar y tu cita es para tal fecha, ya son 3 meses, ya cuando uno va al doctor ya
no tiene nada. Ya siente si usted ha ido al doctor, siente que la cultura hispana está representada. Cuando va o siente que hay mucho del tiempo la accesibilidad del lenguaje es algo que le impide.
Lo que miro yo que en lo que es relación a la medicina, son muy pocas personas hispanas, más es la persona asiática. Pero al menos en mi caso, siempre, si es en el inglés, porque son palabras a veces como más complicadas en la medicina, siempre tengo intérprete.
Bueno, entonces siempre hay un intérprete ahí que le puede dar. Ok, qué bien.
Additionally, Boyle Heights faces a well-documented park deficit, limiting residents' access to physical activity, nature, and vital health benefits. To gain better insight into the safety of community areas and parks in Boyle Heights, we asked Luciano, a local resident, for his perspective.
Yes, they are utilized. Some of the bigger parks that are, really pretty with a pond, and they look like they would be Hollenbeck Park. It's sketchy. I feel comfortable, but my wife doesn't feel comfortable.
Reflecting on safety and accessibility to groceries and resources provided us insight into the challenges that residents face in their day-to-day lives. There are many limitations to accessing primary and emergency care, leading us to ask our providers what these specific obstacles might be.
There's a lot of obstacles. I think the priorities, or the main thing is like the reliable transportation. Like coming to the emergency room is one thing, but like following up with your care, like you have to have reliable transportation to be able to come to the clinics or see your provider like every so often. I believe like they often like delay their care because of the finances sometimes. Like a lot of people don't have like reliable source of income and they kind of rely on, resources to get their care, but they can't really, always rely on that. So
it is, I wouldn't say it's sparse. I mean, We're seeing a lot of patients. My, not interest, but my focus is on oncology. So I have a very particular group of patients. And we do a lot for the patients, but sometimes there's things that county just can't afford. So I had a patient yesterday who could use the medication. The medication is FDA approved across the street, which is the private hospital, North. It's not approved at county. So the patient to be on a study, there's a lot of, let's say, hoops that they have to go through. And if you're sick, maybe you don't want to jump through the hoops. You don't want to get your blood drawn every hour, every 2 hours. So he can't get the blood, he can't get the medication here because we don't have it, but he could go to a private hospital and get it, given the proper insurance. Not proper insurance, but given an insurance that'll pay for it. So that's like a little loophole that my patients fall through. You know, and with all the changes that are going on right now with healthcare and research and all that stuff, we really have to tighten our belts. So there are some medications that patients are just not getting because of, even though we're a safety net hospital, we can't afford certain things.
Despite these obstacles, how can we, as healthcare students and future providers, acknowledge these challenges, improve upon them, and implement them into our practice to better care for our patients?
So things like that, yes, there are definitely obstacles, but when you care about your patients, you're going to figure it out. You're going to try and figure it out. You get people who care, they're going to go the extra mile to help the patient. Yeah, you guys are the future. So, like I said, with anything that you do, any field you go into, you want to make sure you care.
Yes.
Because you can't, even with what you guys are doing, you can learn the technical things and the language and all that stuff, but you can't teach somebody how to care. You got to have that, you know? So you go into this field to care for people. So take that with you.